All right, hello everyone. My name is Chuck Runyon, CEO of Self Esteem Brands, the parent company of Anytime Fitness, the Bar Method, Waxing the City, and Anytime Fitness. And I am thrilled, absolutely excited to talk today about lifestyle prevention with one of the thought leaders in this space, Dr. David Katz. David, thank you for making time. Welcome.
Thank you, Chuck. Great to be with you. Really appreciate it.
Yeah, for those of you who may be unfamiliar with Dr. Katz, let me give you a quick bio before we get started. Dr. Katz has taken a leadership role in response to COVID-19, and you've likely seen him in the media recently, including his op-ed in the New York Times and appearances on CNN, HBO, Fox, and MSNBC. Last week, he was a witness on the topic of COVID response to the U.S. Senate Committee on Homeland Security, and he's consulting with many state governors around the country, including Governor Cuomo in New York. He served as a regular on-air medical contributor for Good Morning America, ABC News, and frequently appeared in Dr. Oz and Oprah, and has authored over 200 scientific articles focused on preventative care and nutrition, and is the author of several textbooks on this topic. Dr. Katz has degrees from Dartmouth, Albert Einstein College of Medicine, and Yale, and has focused his career on preventative health and nutrition, and has become a global leader in this space. He's the founding director of Yale University's Prevention Research Center, past president of the American College of Lifestyle Medicine, and founder and CEO of Diet ID, a company that Anytime Fitness is partnering with for a strategy around coaching anyone, anywhere, anytime. That's a mouthful. I'm suddenly not feeling very smart, Dr. Katz.
Well, it's a very kind intro, Chuck, but you know, when all is said and done, I'm working out of my house just like everybody else. So we just level the playing field and drive forward.
So before we get to any serious topics, what are you doing to stay active during shelter in place?
So all the things that I was doing before, many years ago, I put a home gym in. I had an elliptical, I got a rower, and you know, I mean, basically for me, the easiest thing has been to interdigitate working out. And then I'm really privileged. You know, Connecticut's an interesting place, small state, lots of diversity. I'm 20 minutes from the Yale campus. I've been living here for nearly 30 years, but just outside my door, I've got hiking trails that go on for miles through the woods. I could do a 5-mile loop hike in the woods, literally from my door, not see another soul, which these days, of course, is a good thing. So, you know, I've got lots of good options. I stay active. I've got dogs to walk. I've got a horse to ride. I'm pretty privileged in that regard. So I've stayed active. And, you know, I think the other thing that's really crucial at this time is managing our stress levels. You know, we were all working too hard to begin with. Now we're managing the weirdness. But I've always found, for me, physical activity really was the best way to manage stress. You know, I mean, at some point, that list of stuff we in lifestyle medicine give you that you have to do, it starts to be kind of long, right? All right, so you have to eat well every day. We can talk about that. And you have to exercise every day. We can talk about that. And you have to find time to relax and manage your stress. We can talk about that. The reality is, though, I think these things really interrelate in powerful ways. And, you know, for some of us, physical activity on a routine basis, it is the stress relief, right? So, you know, it frees your mind. I think it enhances productivity, good for your immune system balance, all that. So I practice what I preach. I eat optimally. I try to get enough sleep. I don't use harmful substances. And I stay physically active one way or another, no matter what the heck is going on in the world.
All right, well, you got to have some unhealthy vices. Come on, give us 2 or 3.
Well, I think I do work too much, too hard. Certainly, my wife will weigh in on that. You know, I'm not great at managing stress all the time. I worry in this situation, for example, you know, that I'm not doing enough. And sleep is a problem for me. It's not that I don't give it the respect it deserves. I'm just not good at it. Takes me a while to fall asleep. I often wake up, then I don't fall back asleep. So yeah, I'm definitely not perfect. And, you know, I've always felt like I should meditate. And then I've never felt that I've had time to meditate. You know, I think of meditation as, okay, I wonder how many emails I could have answered during that block of time, right? You know, so I know I'm doing it wrong. But there's a joke about meditation. If you don't have time to do 5 minutes a day, you need to do 20 minutes a day. I'm that guy.
Well, I think our audience will find it comforting to know that even a thought leader like yourself sometimes struggles with a little bit of that balance. That's very good.
For sure.
So, I really do want to spend a good deal of our time talking about lifestyle prevention, right, with one of the thought leaders in space. But first, I think we probably should take a moment just to talk about COVID-19. I mean, you've offered what I would consider as a very pragmatic approach, and for some, maybe a controversial approach. And it's clear, like as a doctor, of course you want to save as many lives as possible, but you've also said that, one of the single biggest drivers of deaths are related to poverty. And therefore, in the past weeks, you've kind of summarized that, look, we should keep at-risk people and those vulnerable, right, safe, but maybe allowing those at much lower risk to maybe re-enter society, maybe, prove some economic resiliency, potentially develop the immunity. I mean, and maybe you can explain, has your thinking changed at all over the last few weeks?
Not really, Chuck. And to be clear, I'm retired from patient care to do these other things in public health and to run Diet ID after nearly 30 years. But I did volunteer and spent 3 12-hour shifts on the front lines in an emergency department in the Bronx because, there was a call from New York. If you're a clinician, if you're a licensed physician, if you can help out, please help out. I signed up. And I decided I would give, about a week's worth of time or 40 hours. So I got 3 12-hour shifts in the emergency department. I've seen this close up, and it really hasn't changed my views. And to me, the controversy is odd. And I think it's actually more reflective of the polarized state of our society than anything truly provocative I said. I think our ideas so easily get characterized. So the idea that maybe we don't all need to hunker in our bunkers. Well, wait a minute, you're trading off lives against dollars in the economy. No, absolutely not. I'm not an economist. I'm a humanist. I'm a public health physician. But it was, and so I'll sum this up very quickly, but it was clear to me from the global epidemiology, and it remains clear to me from the epidemiology or the public health experience of this disease in America, and it remains clear to me after spending 36 hours on the front lines wearing an N95 mask, that this is not just one disease. It's very different diseases in very different populations. So for the people that were coming into the emergency department from nursing homes and ambulances, this is a terrible disease, absolutely terrible. It kills them routinely. We need to do everything possible to put firewalls around our nursing homes. We need to do everything possible to protect frail elderly. And we need to do quite a lot to protect younger people with a serious burden of chronic disease. They can't get this. It's a really bad actor. But the bulk of the population that gets this doesn't even know they have it. It looks like maybe a majority or at least a sizable minority of the cases are asymptomatic altogether. Many more are mildly symptomatic. People get it, get over it, barely know they had it, or it feels like a bad cold. That's how this plays out in a younger, healthier population. So if you shut down everything, people can't go to the gym, for example, and people worry about going to the doctor for other things that were a problem in their health before, and everything else, and all the reverberations of this through our society. You start to devastate lives. It's not like we're talking about people's retirement plans exclusively. We're talking about people who are living hand to mouth, people who are living off tips, people who have trouble putting food on the table if they don't have a job. All of that is in play. And with now well over 30 million people in the United States unemployed, someone who spent a career in public health and thought a lot about social determinants of health, how poverty affects health, how food insecurity affects health, it just started to look to me like, wait a minute, we may hurt more people than we help. We may be protecting people who don't really need to be protected. And we may be adding to those who are harmed by the virus, those who are harmed by economic ruin, hunger, desperation, destitution, addiction, violence. And we've seen surges in all those things. We've seen surges in domestic violence. We've seen surges in child abuse. We've seen surges in addiction and surges in suicide. So sadly, those early predictions I made writing in the New York Times have come true. So while we are dutifully tallying the toll of SARS-CoV-2, the virus, the number of people killed by the infection, we also need to be thinking about the toll of essentially economic and societal collapse. My argument from the start was both of those matter. Any way you hurt people is bad. Any way you help people is good. And our goal needs to be total harm minimization. And then one other very important thing, Chuck, and that is, how do we get to the all clear? We basically need to establish an equilibrium with this virus. And that really comes one of two ways. It either comes with a vaccine, which is optimistically 18 months away, but could be much longer, or it comes with native immunity. And that means the people in our population who can most safely encounter this disease get it, get over it, make antibodies and are immune. And then we protect our older relatives, we protect our frail relatives and loved ones, because if we're immune, they can't get it from us. That's been my argument all along. I've been to the front lines. I still feel that way. And more, I think that's the direction our societal response is shifting in. And to be clear, it was never to me a debate between everybody hunker in a bunker on an indefinite timeline until there's a vaccine, and we can hope but really not expect that anything about life as we knew it before will be there when we come out, versus everybody back in the water, including grandma, never mind the riptide and the sharks. I always thought that was silly. It always seemed to me, no, the right response is in the middle. Some people are very vulnerable, have to be protected, and we should be doing an even better job of protecting them. Some people can safely get this thing and probably need to, so we can plot a course back to something like life as we knew it before and achieve herd immunity. And the goal, motivating everything we do, should be total harm minimization. Felt that way at the start, pretty much feel that way now.
So the fast-moving pandemic of COVID has seemed to shine a light on the slow-moving epidemic called obesity.
Right.
There seems to be a link between those with underlying symptoms of whether it's type 2 diabetes, cardiovascular disease, obesity, or those forms, right? Those issues associated with obesity. Elaborate on that. What are you seeing?
Well, first of all, it's my opportunity to thank you for what you do, being a leader in the fitness space, and to thank the franchisees who are, basically making it appealing and accessible for people to fit physical activity into their weekly routines. It's never been more important. So yeah, there's a bright light shining. And you know what they say about a crisis, it's a dangerous opportunity, right? Here's the opportunity. So I trained in internal medicine, which basically is the specialty where you take care of everything that goes wrong with adults. And because I saw so much preventable disease during my training in internal medicine, went on to train in preventive medicine. And then my career has been focused on lifestyle, in particular nutrition, but nutrition, physical activity, those things that we can do to alleviate the burden of disease where it falls on us most heavily. And that's chronic disease. That's obesity as a risk factor, cardiovascular disease, type 2 diabetes, cancer, stroke, dementia, and on it goes. Here's the trouble, Chuck. Type 2 diabetes does not activate the fight or flight response. Cardiovascular disease, coronary disease does not activate the fight or flight response. If I tell you the way you're living now means, you're likely to need coronary bypass surgery in 10 years, you say, okay, well, I'll fix it tomorrow, and maybe tomorrow, and maybe tomorrow, and tomorrow never comes. The human response to risk, is sort of endowed to us by our evolutionary experience. We worry about tooth and claw. If it's coming at us right now, we can see it. It activates the adrenal gland. You feel that tickle, and you're ready to fight or flee. And with chronic disease, we don't have that. So it's really hard to get people's attention, and so those of us in lifestyle medicine and those of you in the fitness space, we have fewer customers than we ought to have. Everybody should be paying attention to us all the time. They should care enormously, because what you and I do pertains to the greatest driver of years in life and life in years. Basically, fitness, nutrition, that combination, what we do with our feet and our forks every day, assuming people don't smoke, diet, physical activity, the two leading determinants of the bounty of years in your life and the vitality of life in your years. And yet, because it's all in slow motion, neither of us has the attention of the public we deserve until now. Because right now, everybody is worried about all those same factors because they're an acute risk for COVID. So as you say, obesity, hypertension, coronary disease, type 2 diabetes, these are all inflammatory states. What's really clear about COVID is that the virus, SARS-CoV-2, can only do a certain amount of damage to us. Most of the really bad stuff that happens is actually the immune system not responding optimally to the virus. And the reason the immune system doesn't respond optimally is either because it's failing and frail, that obviously happens in people who are 80 years old, or because it's in overdrive. And that happens in people with inflammation. And inflammation is driven by obesity, coronary disease, type 2 diabetes, hypertension, all the stuff that far too many Americans have. Here's the opportunity. The stuff that you and I do to try and alleviate the burden of chronic disease is absolutely the single best way for people to drop down in risk tiers relative to COVID. This disease has taken all the chronic liabilities of American health and made them acute. And that means you can fortify yourself against the threat of encountering this bad bug in ways that will make you healthier and more vital for the long haul too. It's the gift that keeps on giving. So I think there really is an opportunity to make lemonade from the lemons here.
So this is the topic I really want to talk about. It really gets me excited. Let's get beyond COVID. And I love that term, feet and forks. I'm going to have to use that again. So you stated with your experience that 80% of chronic disease is preventable with a healthy lifestyle. And so let's pretend for a second, all right? So let's say after the next election, whatever administration gets in there, you are given this moonshot goal of creating a culture of health for this country, right? Taking it from a liability that it is today and turning it into an asset, right? You're given those marching orders and you're given a massive budget and you've got a decade to reverse the trends of health, which are going in the wrong direction, right?
Yeah.
And creating this culture that emphasizes the importance of personal wellness. What do you do?
Yeah, well, boy, I'd welcome that opportunity. And to be honest, if you really did have that level of authority and those resources behind you, it wouldn't be all that hard because, to be honest, right now we conspire against health in some fairly flagrant ways. I'll give you one quick example. By the way, Chuck, I just want to say how much I and the team at Diet ID appreciate the collaboration, because feet and forks together, I mean, that really is powerful. Feet, forks, and fingers, that's the trifecta, right? So no smoking, physical activity, optimized diet, 80% of all chronic disease can go away. So I could cite the studies that back that up. But
I love it.
Feet, forks, and fingers. And by the way, just to be clear, one study I will cite, actual causes of death in the United States. So this seminal paper in the Journal of the American Medical Association was published in 1993, 27 years ago. That was the year I completed my training at Yale in preventive medicine and public health. And essentially what that paper did was look beyond death certificates to say, no, it's not enough to know that heart disease, cancer, stroke, diabetes is the cause of death. Those aren't really causes. Those are effects. What's causing those diseases that are causing premature deaths? And the answer was feet, forks, fingers, and a list of 7 other factors. And when the two authors, Bill Faggy and Mike McGinnis, were done with a list of 10 factors, they had explained away almost all of the premature deaths that occur in our country every year, and that's a huge burden. But 80% of the action, 80% of premature deaths, feet, forks, and fingers. Optimizing physical activity, dietary pattern, and not smoking. So assuming that we're doing better with tobacco, what we can do together is focus on that combination of optimizing diet and physical activity, and 80% of all chronic disease can go away. So again, if I ran the zoo and had those resources, first thing I do is make sure everybody understands the value proposition. You know, and you have to help people get it, because, you know, we talk about 80% reduction in the burden of chronic disease, doesn't make anybody cry. But if I ask you to think about the people you love, and I ask you, you know, anybody you love affected by heart disease or cancer, or stroke, or dementia, or diabetes, you know, if you live in this country, the answer is going to be yes. And then I invite you to think about that person and conjure that face to your mind's eye and think about the day you got the news. And we can do this in a room full of people. I've done it many times. And by the time you're done asking, heart disease, yes. Cancer, yes. Stroke, yes. Dementia, yes. Diabetes, yes. Everybody's hand is up. Now I say, imagine a world where 8 times in 10 people in this room did not raise their hand, because that's what 80% less chronic disease would feel like. It's not a statistical concept. It's not remote. It will affect you and your family. It will affect me and my family, people we love. We're talking about stuff we would feel. First, I want to make sure people would understand that. Second, I want to remind people what health is for. Health is not something you should do because a guy like me is wagging my finger at you. Health is something you should do because healthy people have more fun. Mic drop. Healthy people have more fun. That's the reason you should care. Not because anybody says you should, but basically, other things being equal, healthy people live better lives. You can do more of the stuff you like to do, whatever that is, you decide. And, you know, at some point you may decide, yeah, I mean, if I were even healthier, it might be great. But at this point, I'm starting to suffer. It's good enough. I don't need to be a triathlete. Okay, up to you. You draw the line. You're the boss. But I think everybody should understand that you will feel it if we have 80% less chronic disease. And the reason you should care about health for yourself and the people you love is it makes lives better. And then people deserve to have knowledge about what is fundamentally true and important about feet, forks, and fingers. Everybody should know that, tobacco should be consigned to the dustbin of historically bad ideas. Physical activity is not a burden or a chore. Exercise is not a burden or a chore. You have a native animal vitality. It does not want to be in a cage. It does not want to be on a leash. Set it free. That's what exercising does. It basically just awakens the native animal vitality that is your birthright. Relish it. And you think about, how we see someone in a wheelchair, and, oh, that's too bad, right? I wonder what happened, and will they be able to get up again? But most of us who have perfectly serviceable legs seem reluctant to use them. What sense does that make? It's a blessing. We can count our steps if we want to, but let's count our blessings. If everything you've got is working, use it and enjoy the privilege of using it. So I think message framing is crucial. There are fundamental truths about diet for health. I think everybody deserves to know that. Of course, we're working on that at Diet ID. We can tell everybody what their diet is, what their diet quality is. We can compare it to what they want it to be. We can empower people to personalize their route to better nutrition. And then, again, you gave me supreme powers here and a big budget. I would also fix the parts of our society that conspire actively against getting health right. So we actively market junk food to kids. That's unconscionable. That's basically favoring corporate profit over the future health of our children. That's just wrong. The food supply in the United States is willfully engineered to be addictive. There are scientists working for big companies that actually get bonuses if they can design food you can't stop eating until your arm gets tired from lifting it to your mouth. And you want to read more on that topic, I commend to you the work of Michael Moss, Pulitzer Prize-winning investigative journalist, author of Salt, Sugar, Fat. He wrote a New York Times Magazine cover story entitled The Extraordinary Science of Addictive Junk Food. Just let that title sink in. The Extraordinary Science of Addictive Junk Food. Literally, these guys use functional MRI machines to scan our brains and figure out what do we need to do with formulations to make your appetite center light up like a Christmas tree. That's wrong. So, docs like me and health coaches advise people, fitness instructors advise people on portion control, but they're up against a food supply engineered by people who get bonuses using functional MRI machines to make sure you can't exercise that restraint. That's wrong too. So I would fix some issues on the supply side. I would basically engage in a comprehensive educational campaign so people understand the value proposition, what health is for, and how much we really do know about fundamental truths regarding feet and forks, and then let come what may. Because at some point, I think it is up to individuals to decide what matters to them. But I think if we made it easier for people to make healthy choices, made them understand how big a difference it could make in their lives and for the lives of people they love, I think most people would want to be both active and eating optimally. And the last thing I'd say is that for both of these things, we're not just talking about the long-term benefit, right? It's not just you won't get dementia years down the line. You'll feel better today, right? Eating optimally, being active, feels good right now. So, again, I don't think it's a hard sell. I just think there's a lot of stuff in the way that has to be cleared out.
Yeah, I remember reading the New York Times years ago. There's an article about the science, the thousands of hours that goes into making the perfect Dorito, like an addictive taste. And I don't know if that was it.
That's the one. Exactly.
That was fascinating. That was fascinating.
Yeah, the bliss point. Right. That's the Extraordinary Science of Addictive Junk Food, Michael Moss. That's the article. Yeah, absolutely. And by the way, we can juxtapose what Moss was saying in that work with an op-ed in the New York Times, August 26th of last year, 2019, Our Food is Killing Too Many of Us. So this was a piece by Dariush Mozaffarian, who's Dean of Nutrition at the Friedman School at Tufts, and Dan Glickman, former Secretary of Agriculture. And in that article, the two of them cite the very clear evidence that diet is the single leading cause of premature death and chronic disease in the United States today. Physical activity is number two, lack of physical activity is number two. So we're both, again, you and I are partners, and everybody listening in, potentially partners in this enterprise to fix what's most badly broken. We now have the opportunity to apply the same strategies to reduce the risks of COVID. But that's just incredible. So, on the one hand, we turn a blind eye that our food supply is booby-trapped to basically take advantage of liabilities in the human appetite center. And on the other, it's the single leading cause of premature death. Well, clearly those dots need to be connected and we need a remedial strategy. So if you put me in charge as you propose, Chuck, I pledge to you that I will do that.
Deal. I think if you go upstream, another problem is what I would call body illiteracy. So, we've spent, of course, vast resources on measuring and teaching IQ. And in recent decades, we've even begun to understand emotional intelligence, EQ. I can tell you, after 30 years of being in the fitness industry, generally people have very low BQ, very low body intelligence. And they are just not equipped to enter a world surrounded by fast food, right? Surrounded by technology that kind of enables them to be sedentary. And, most people vastly underestimate caloric intake. They overestimate caloric burn, and they just don't understand how nutrition, activity, and sleep blended together form this power source for your life, everything you just kind of mentioned. So what do you think about that body illiteracy? I mean, in your work, have you seen that? How do we fix that at scale? What are your thoughts?
Yeah, I totally agree. So you could argue that we could fix it one of two ways, and maybe we need both. So one way to fix it would be sort of the blue zone way. I don't know that there's much better body literacy in the blue zones, but in case people don't know, there are 5 blue zones characterized by Dan Buettner, who's a National Geographic fellow. And these are the places around the world where people most routinely live to be 100, don't get chronic disease. And then, at 102, go to sleep and just don't wake up. So they go gentle into that good night in the fullness of time, live long, prosper with vitality, go gentle into that good night. 'Tis a consummation devoutly to be wished. 5 blue zones: Sardinia, Greece, Sardinia, Italy, Ikaria, Greece, Okinawa, Japan, Loma Linda, California, and the Nicoya Peninsula in Costa Rica routinely live to be 100. I don't know that they've got better body literacy than us, but what they've got is cultures that make physical activity normal. Everybody's walking all the time outside, strong social connections, optimal heritage-based diets. They don't tend to smoke. They get plenty of sleep. They're not stressed out. So feet, forks, fingers. So, physical activity, optimal diets, not much tobacco, sleep. They get enough. Stress, they don't get too much. And love, strong social bonds. And I've long argued that feet, forks, fingers, sleep, stress, and love, that's the 6-cylinder engine of lifestyles medicine. So one way to address the body literacy issue would be culture. Get it right at the level of culture. Maybe people don't need to know too much. They just need to fit into a culture that makes health normal. But here, it's exactly the opposite. Basically hectic schedules, or at least we did before COVID, and it's different now, but we're stressed out for other reasons, but chronic stress, chronic insomnia and sleep deprivation, inadequate physical activity. So if we do a little bit, and if you're inactive all day, but you go to the gym, you think you burn 10,000 calories, right? Everybody gets that wrong. Because we're a high endurance kind of animal. So we greatly overestimate the energy expenditure from just a short bout of physical activity. And yes, massive distortions in people's perception of how many calories they're eating, especially because processed food packs a whole lot of calories into tiny spaces. If you eat whole, unprocessed foods, those calories take up a lot more space and the volume fills you up. But the more processed your diet is, the more calories are packed into smaller spaces. So you're absolutely right. I think body literacy, people, and the other thing that's happening is as obesity becomes very much the norm in our population, higher levels of weight are perceived as normal. I would have thought I was heavy, but I look around me and, I'm less heavy than everybody else, so I must be lean. And what's happening is the whole bell curve is shifting. That would be fine if it were really just attitudes and self-esteem. I want people to be happy with the skin they're in. But it's not fine when you have massive type 2 diabetes, not just in adults, but even in kids, because of the bell curve moving. So we need to fix that. And since we're not going to fix our culture in one fell swoop, I think it absolutely is crucial to raise awareness. So I think people need to understand body composition. I think they need to understand energy balance and energy expenditure. I think they need a better notion of the total calories they need and the total calories they're getting. I think they need to understand how to achieve satiety. I don't want to spend my life counting calories, but calories do count. How do I reconcile those two things? Well, if you eat high quality, minimally processed foods, mostly plants, as Michael Pollan put it, right? Eat food, not too much, mostly plants. One of the many virtues of those unprocessed foods is they fill you up on fewer calories. If you're physically active on a regular basis and eating actual food, in its relatively native state, there are native systems in your body that will help you get energy balance right. Those things fall apart when you're never active and when the food you're eating is highly processed and designed actually to put your appetite center in overdrive. So absolutely, I believe entirely in empowering people with an understanding of these concepts. And then what I think we can have both. You know, I think if enough people understand what's broken and are really concerned about fixing it with body intelligence that they apply to themselves and their loved ones, that starts to become a cultural revolution. Because at some point there are enough families in on it that say, wait a minute, why should we all need to work so hard? I can defend myself and my family, so can you, but they can't. And there's an awful lot going on in the world around us that seems to be preying on these vulnerabilities enough. I mean, I've long imagined, Chuck, the world's greatest special interest group, lovingparentsandgrandparents.org. You know, I mean, it puts AARP to shame. It's like the world's biggest special interest group. And it says, we will stand for nothing that puts the health of our kids and grandkids at risk. I pity the fool that gets in their way, right? So, I mean, and you know, I think if we get enough people to understand how the future health of our children is being mortgaged in this country to, you know, to pay for special interests and fatten certain corporate coffers, I think we could have that revolution. So we start with empowering individuals, and then we use that level of concern and passion and outrage as the basis for changing culture.
All right, so when you get this job as like our health czar, right? I'll give you two other things.
You're going to help me get this job, right?
Yes.
I think I hear you saying that.
Yes, I'll get all of our franchisees mobilized. So, you know, to go, you talked about the health of our children. What's even a bit more alarming is if you look at like extracurricular activity and participation in sports, there's been a steady decline over the last 30 years.
Right.
And due to budgetary issues, like FIAD has continued to be cut, you know, from school systems. And like we know the science that links, you know, physical activity with mental acuity, yet we continue to cut it. And, you know, again, you know, people are not graduating understanding what their resting metabolic rate is. They don't really understand how their body works. And right. So, you know, I think it should stop being elective. I think we should rethink how we teach health and activity and sleep and nutrition from kindergarten through college. This should not be an elective, right? This should be something that is a part of the core curriculum. And then I'll give you another idea, something we have talked about quite a bit around here at Anytime Fitness, something we're striving for. But have you ever considered the idea of a personal health score? Much like how the lending sector has a personal credit score, right? Something that gives us visibility and some control over our health, right? We can personalize it and help people become the CEO of their own health. Maybe this could be used for lower health insurance premiums, or, you know, a variety of other industries could maybe incentivize, you know, if you control that or if you improve that. But give me your thoughts on that.
Yeah. Well, let me address both topics. So first, totally agree with you about physical activity and the value proposition in education. I have 5 kids, all grown now. My son looms over me, 6'3", he's 21. But when he was 5, his mother had him at one of my talks, which he could not sit through. We were in a big auditorium at Dartmouth. And anyway, it got so out of control. He was driving her crazy. Eventually, I had to interrupt the talk and say, folks, excuse me, my son's torturing my wife. And I had to get up and run laps around the auditorium. And when he came around for like lap number 3, half a dozen kids got up and took off after him. And when those guys came around, every kid in the audience under the age of about 12 got up and took off after these guys. So we have now 35 kids running laps around my talk. And a program was born that day. ABC for fitness, activity bursts in the classroom. This was many years ago, but we actually developed and validated a school-based physical activity program called Activity Burst in the Classroom. You know, I told the people in the audience that, hey, look what's going on here. We take naturally rambunctious kids and, you know, basically send them to school, bolt them to chairs all day long so they can grow up to become adults we can't get off couches with crowbars. And if they make a fuss about it along the way, we call them hyperactive and give them Ritalin. The proper remedy for rambunctiousness in children is recess, not Ritalin. So we developed this program, which, you know, basically said you can't teach kids for 6 hours straight anyway. At least fold physical activity in intermittently to let them dissipate that restless energy. And then we studied it. And by the way, this program's freely available. It's widely used. ABC for fitness. We published it in the peer-reviewed literature. It's in thousands of schools around the world. And what we were able to show, Chuck, is that the kids who got this program relative to controls, more minutes of daily physical activity, better behavior in the classroom, at least as good performance on standardized academic tests, less prescription medication use, less Ritalin, less medication for asthma. I mean, it was just good across the board. Totally agree with you. Absolutely. And then on the other issue, the issue of a personal health score. Yeah, amen. I've been saying for many years, and again, I'm starting to get the impression you and I are brothers who are somehow separated. I've been saying how much good it would do in this country if we could just treat health a little more like wealth, right? So people get these credit scores and, everybody's very concerned about that. It's all about money. Well, what about health? I mean, we all know the aphorisms, right? If you don't have your health, you don't have anything. Yeah, but we don't really treat it with respect. What if we thought of health as something you invest in, you nurture, you build over time, you share with the people you love, you endow to your children because of your example. And, you make health a family value. And well, then, if it's that important, which it ought to be, we ought to be able to measure it. And we ought to be able to, basically strive for certain standards. So we basically have started arguing for that very value proposition with Diet ID. So we measure diet quality objectively. The Healthy Eating Index 2015, it's a 100-point scale. We can tell you exactly where your diet is relative to where you want it to be, because that all translates into the risk of all the bad stuff we don't want to have happen to us and all the good stuff we do. It would be even better if you had a comprehensive score for your overall vitality. And, we argue at Diet ID, diet is a vital sign. Well, really, it's your overall vitality that's the most important vital sign. In terms of the things that I can alter, that I can control, where is my overall health risk? What is the likelihood of me living long and prospering with vitality? And what can I do to make it higher? And I think that should figure in actuarial assessment. It has implications for the cost of life insurance, health insurance, all of that. But it basically becomes a personal asset that everybody cares about and incubates. Again, your credit score, you don't want your credit score to get messed up. Why? Because it's damn inconvenient. Because, if your credit score gets messed up, you may not be able to do something you want to do, like buy a house. Well, I got news for you. If your health score gets messed up, you almost certainly won't be able to do things you want to do because you'll be too busy visiting the endocrinologist when you really would rather be on vacation. And absolutely, no question. And I do think it's reflective of a society that's gotten some of its priorities fundamentally wrong, that it's so expected that you'll be tracking your credit score, and a given that you'll have pretty much no body intelligence and no notion of what your health score is. But yeah, I would love to work with you on assembling a health score that people could track routinely.
I'm serious about that. Let's talk about this offline. And a lot of people object to it because they think it's about body shaming, or, it has to take in consideration gender, age, pre-existing conditions, things you cannot control, right? Well, I'll make that very clear. But for things you can control, how do we give you visibility and influence over that so you can be the CEO of your own health?
I totally agree. And, there are models that kind of get close to that. So, there are age calculators that will translate your chronological age into your biological age. Again, I don't think it's the sort of thing that people routinely look at and say, that's a health score I can manage and I should know. But there's some work in that area that I think could be translated into this. But yeah, I agree with you. It's absolutely, any more than, credit scoring should not be about shaming people either. We really want to leverage this as an asset where, knowledge is power. If you know what it is and you know the advantages of it being something else, you can try to make up the gap. And ideally, you should get all kinds of help to do that. Again, that position that you're promising me with the federal government, yeah, I'm gonna make sure that everybody has the resources at their disposal to optimize their health and vitality score. But yeah, no, really important. And these things, there's obviously a real theme in everything you're talking about. You are an agent of empowerment in everything you're saying. I mean, you're talking about things people need to know and don't know. And wouldn't it be better if they did? Absolutely. Things people need to have in their daily routines and don't routinely have, like kids getting physical activity in the school day. Absolutely. And it would empower them and it would make them better learners. And no, it would not be at the expense. Recess is not at the expense of reading and arithmetic. The right kind of recess actually makes the kids better at reading and arithmetic. They all go together. So reading, arithmetic, and recess, that's really a healthy trifecta. All the things you're talking about, Chuck, make it very clear your mission in life really, is to empower people to own their own health. I salute that.
I love that. Recess, not Ritalin. I love that. And by
Yeah.
the way, you mentioned something earlier about us, like almost being brother. Like, thank goodness I'm not the brother of Dr. David Katz. That would not be good for my I've got enough problems. Life is hard enough already, man.
I bet we'd be okay.
Only approximately 1 in 5 people in this country are a member of a commercial fitness center, right? Between all the studios that we have and all the clubs that we have. On behalf of the fitness industry, what can we do better to influence the health of this country?
Yeah, well, first of all, again, I thank you, and I thank everybody listening, because you're a big part of the solution. But as I said, I think one part of the problem is most people don't realize that exercise is not a chore, exercise is not a burden, exercise is a blessing, a privilege, and an opportunity. So I think we can communicate that better. You have a native animal vitality. It wants to run free. I don't know the best way to say this, but I've long thought about it. I know that, if I see somebody with a cast or crutches or a wheelchair, my native initial response is, oh, that's too bad. It's not really pity, but it's just thinking, I hope whatever's wrong is temporary. I hope they can get up. I hope they can jump or dance if they want to, right? So, if somebody told me, I'll give you a certain amount of money and I'll take away your legs, it wouldn't matter what the amount, I'd fight them off. No way, right? And yet you think about how many people have perfectly workable legs that they don't use for anything. And then if you don't use it, you lose it, and you succumb to decrepitude, and then, all of a sudden you can't jump and you can't dance. So I think part of what we need to do is help people understand it's a blessing. Sure, count your steps, but count your blessings. You've got working legs, use them. Walking it's a beautiful thing. Your body wants to do it. I think the idea that healthy people have more fun doesn't get nearly enough traction. I think there's a lot we could do empowering people to understand that, that this is not, a chore that, somehow combines sweat and spandex. This is a beautiful opportunity. This is just, it's letting your native animal vitality out of a cage. Let it be free. And then we have another problem. And the other problem is, we do have huge social disparities in our country, and the people who most need our help have least access. They can't afford anything. They can't afford gym membership. They may live in a place, they may be furthest away from the franchises, and on it goes. This as well as I do. So there, I think there's sort of 2 tiers here. There's, as a business person who's doing good in the world, how can you reach a larger portion of the audience you really ought to have? And then just as an agent of empowerment in the world, what can you do? And I ask the same question all the time. What can I do to reach the people who are hardest to reach? They actually need our help even more. What would that look like? Would it look like wellness programming built into health insurance that actually makes gym membership free for them, and maybe, offers a health coach too, and kind of eases them into the system? Everybody could win. Now, all of a sudden, the things you do, the things I do, we have access to much larger populations. But maybe in some cases, it's not the individual that's paying for it, it's the health insurer, because their choice would either be spend less on the value of physical fitness and body knowledge and all of that good stuff and optimal diet, or spend more on coronary bypass and dialysis and institutional care, right? And so I think there are ways to connect all these dots. So I think we start with messaging to try and reach the audience that has the means to take advantage of our wares. But I would really like to see the full public health potential of this realized, so everybody who could benefit has access. That's what healthcare would look like. We talk about healthcare in this country. We don't have it. We have disease care. We have third-party payers who will cover the cost of disease care. If we had a healthcare system, they would be covering the cost of gym membership routinely. Now, I'd like to see that day dawn.
Yeah, by the way, another thing to add to your list as health czar would be creating some health opportunity zones where there's some incentives to provide access to either fitness and nutrition in low-income areas, because as there's just not the accessibility there. So that's something we definitely want to look into on behalf of our franchises.
Totally agree. Absolutely agree. And, and both indoor and outdoor, and you need to do things to make outdoor activity safe in some of those areas, and on it goes. Yeah. So, once we start really getting into it and not just wanting to fix this problem for those who can take advantage most readily, but fix it where it's most badly broken, yeah, then we need a whole suite of policy initiatives. And some of them have to do with the physical and built environment, and some of them have to do with reimbursement structures. But there are these perverse incentives in our society. If you do nothing about your health until you've lost it, there are all sorts of ways to access other resources. But if you don't want to lose it in the first place, then just try to get help. I'll give you a very quick example. I want to be mindful of time, but many years ago, I was working at the Yale Health Plan in internal medicine. I had a patient, so I was taking care of people affiliated with Yale, students, faculty, but also the custodial staff for the university. So one of my patients was on the custodial staff, you know, making something just above minimum wage, living hand to mouth. And she had all of the usual cardiometabolic risk factors for, you know, really bad outcomes, type 2 diabetes, hypertension, dyslipidemia. But I persuaded her to really care about lifestyle, and she started walking and walking more and more, and she started losing weight, and her lipids got better, and her blood pressure got better, and everything got better. She was doing beautifully. And then it started to slow down. And I asked her what was going on, and she said, look outside. It's fall in New England. I've been doing all this walking I've been doing for months has been outside. It's cold and, you know, it's sleeting. And I said, well, how about a gym membership? I can't afford that. And, you know, doesn't the university make the gym available to you? No, I don't have that privilege. And, you know, what about, buy a treadmill or something? I can't afford that. I asked the Yale Health Plan, look, spend $500 on a treadmill, put it in her apartment. You're going to wind up spending money on her coronary bypass surgery, you know, at which point she's lost and you lose. Just put a treadmill in her. I couldn't talk them into it because it was outside the box. That just shows how perverse the incentives are. All of that nonsense has to be fixed. So, you know, again, when you appoint me czar, taking care of that stuff.
Well, when you were telling that story, I could see the light in your eyes kind of light up a little bit. And we've had a career filled with like these life transformation stories, and nothing feels better when you can help someone change their life, and it starts with their health, right? And that cascades out to every area of their relationships, their productivity, work, how they feel about themselves, and so that's what always keeps us going. And you mentioned a couple times during this interview, health coaches. So on behalf of Anytime Fitness, we're moving far more towards coaching, meeting our members where they're at. They're far often spending more time in their home, the workplace, right? They might visit the gym 2 or 3 times a week. Technology now and coaching allows us to help them adopt healthier behaviors. And we have certified personal training, and we have health coaches. And over the next decade, I'd sure like to believe that the medical community and the fitness community come closer together and become more integrated.
Absolutely.
I mean,
and you know, again, if we had a health care system as opposed to just a disease care system, it would have started out that way. I mean, the idea would have been, what are the ways we put together teams who help people own their health, who know it, own it, have control over it, optimize it. Absolutely. And, you know, we've got all sorts of opportunities, you know, by pooling the things we're working on. And I do see this evolving. And again, as bad as the COVID crisis is, it is making people acutely aware of the costs of chronic disease. And I really do think we have an opportunity to leverage that and make us stronger, not just to withstand the pandemic and come through it, but healthier as a nation. So I really look forward to this. This is a great discussion, but you know, you and I can do lots of great stuff together. I'm delighted to have opportunities to work together.
So I'll do the last question is, I try to remind our owners that we're not providing treadmills or 24-hour access. We really provide, first of all, empathy. We provide education. We provide motivation to our members, and then a mix of accountability. And, you know, very few people can make this change on their own. And so what message would you give to our network of personal trainers and our health coaches out there? How can we help our members adopt healthier lifestyles, you know, make positive behavior changes for the long term?
Yeah, no, it's great. And I've long wrestled in the public health space with what I think is a silly dichotomy. You know, it's as if there's a choice between personal responsibility and environmental determinism, right? So at one end of the spectrum, you know, you've got to lift yourself up by your bootstraps, even if you can't afford boots. And at the other end of the spectrum, it's, you know, oh, woe is me. You know, the world has not made me healthy, therefore I can't be. Obviously, the truth is in the middle, right? So I do think it's important to remember that the choices people make are subordinate to the choices people have. And I think all of you are in the business of making sure people have good choices. So, you know, do all you can to make people aware. Do all you can to make them truly understand the value proposition here. Again, I think one of the things we're all up against is this notion that, yeah, I know I should exercise, right? So, you know, obviously you've got the population you already have there captured, they're in. But if we're talking about the market share you ought to have, you know, and the numbers that ought to be flocking to gyms and taking advantage of all this opportunity to own their health. And again, yes, it goes way beyond the equipment. I think far too few people realize that the reason health matters is because it makes life better. It's not, you know, you're not checking off a box. You're not at the end of an admonishing finger. You're not doing something that someone else says you should do. So I think you want to radiate the joy that vitality gives you. You know, you're sort of you are a walking marquee for the advantages of owning your own health if you're a franchise owner. So I think you represent that. You represent it in your community. In public health, we say think globally, act locally. So, you know, I think globally there's this opportunity to make health, fitness, vitality, body intelligence, the cultural norms. But the real action is local, where, you know, there's a direct connection between you and people in your community who can see you and, you know, understand what the upside to engagement is. That it, you know, you feel better, you feel stronger, you feel more confident. You're a bit less worried about COVID. We're all worried. This is unprecedented. But if your native health going into this is really great, and your family has great health because, you know, health has been a family value for you, you definitely feel less concerned than others. You worry about the other people who, you know, who are not in on that. You feel stronger. You feel like, you know, if I get this thing, I'll be okay. So it makes an acute difference. It makes a chronic difference. So I think you represent that in your community. Make sure, you know, basically you fly that flag proudly, that healthy people have more fun. It's better. You know, I'm not trying to talk you into something that you're going to find onerous. I am the gateway to an opportunity you would want if you understood it.
Dr. Katz, I admire your passion. I admire your pragmatism. And I cannot wait until you are the health czar of this country. And I can't wait to have my own personal health Katz score. That's what we're going to call it, the Katz personal health score. What do you think?
I don't know. I think that gives me too much credit, but we'll come up with something, Chuck. But thank you.
Hey, on behalf of Anytime Fitness, our owners and our coaches using Diet ID, our phrase here is let's make healthy happen. So we appreciate your collaboration. Thank you for taking the time, and we'll be in touch.
Yeah, well, thank you, Chuck. And yeah, let's make healthy happen together. I'm really glad we have that opportunity. Thank you.
Thanks, Dr. Katz. Have a good day.